to Collaboration in Bioethics Education Research. This webinar is the fifth in a series developed by Bioethics Education Resources, or BEdR, which is a project of the Cambridge Consortium for Bioethics Education USA Working Group. This series is produced in partnership with Cambridge University Press and Oakland University William Beaumont School of Medicine. I'm Amy Michelle DeBate from the Oakland University William Beaumont School of Medicine, and I'm your moderator for today's discussion. If you have questions at any time during the webinar, please feel free to use the chat function in the lower right corner of your screen. We will have time for the presenters to answer your questions at the end of the webinar, and we welcome any additional questions that you have after the webinar as well. The Cambridge Consortium for Bioethics Education is a group of international educators in bioethics and medical humanities, which is supported by the Cambridge Quarterly for Healthcare Ethics and Cambridge University Press. The Cambridge Consortium has working groups within various countries that each work during the year on their own projects. This webinar series is part of the work of the USA Working Group. We would also like you to consider attending the Cambridge Consortium for Bioethics Education's annual meeting for 2019. This meeting brings together scholar educators in bioethics, humanities, and the arts and the health professions education from all over the world, and we meet to share promising practices and cutting-edge research in bioethics education. The meeting takes place in Paris in early July at Reed Hall, which is part of the Columbia University Global Centers in scenic Montparnasse. The mission of the USA Working Group for the Cambridge Consortium is to develop and promote standards and best practices in ethics, humanities, and arts education in the health professions, and to equip educators from varied disciplinary backgrounds and expertise with the resources and training for a scholarly approach to teaching ethics, humanities, and the arts and health professions, and to make contributions to the scholarship of teaching and learning. Bioethics Education Resources, or BEdR, is a project of the Cambridge Consortium USA Working Group. Our website is www.bedr.education. BEdR has two current projects. The first is an online peer-reviewed collection of teaching resources in bioethics and medical humanities, which is developed in partnership with Florida International University. And the second is this webinar series, which is developed in partnership with the Oakland University William Beaumont School of Medicine. This webinar is the last in our series on bioethics education research for this year. The previous webinars are all archived online for your reference, and participants in this webinar will be emailed a link to the webinar archive site for future reference. We are currently planning a new series of webinars for 2019 and 2020. Information about that series will be available on the BEdR website soon. I now have the privilege of introducing our presenters for today's webinar. Our first presenter is Dr. Maren Gillis, who is Professor and Chief of the Division of Ethics, Humanities, the Arts, and Design at Florida International University Wertheim College of Medicine in Miami, Florida. Dr. Gillis is also the founding director of the USA Working Group for the Cambridge Consortium for Bioethics Education. Our second presenter is Professor Kendra Kirchmer, who is an assistant professor in the Division of Ethics, Humanities, the Arts, and Design at Florida International University Wertheim College of Medicine. Professor Kirchmer is the design director of the USA Working Group of the Cambridge Consortium for Bioethics Education. And our third presenter is Dr. Claire Clark, who is an assistant professor of behavioral science at the University of Kentucky College of Medicine. Dr. Clark is a co-director of the USA Working Group of the Cambridge Consortium for Bioethics Education. It is our goal that by the end of this webinar, attendees should be able to describe various types of collaborations that scholars of education in ethics, humanities, and the arts can develop and utilize, identify core best practices in scholarly collaboration in bioethics education, discuss current challenges to effective scholarly collaboration in bioethics education, and to explore future opportunities for collaboration in bioethics education scholarship. As this webinar is on collaboration in bioethics education research, we've chosen to develop and deliver this presentation as itself being a transdisciplinary collaboration. Each of the speakers will begin by taking a few minutes to discuss aspects of collaboration in educational research in bioethics and medical humanities. We will then have time for questions for them to answer and discuss together, including questions from our audience about collaboration. and we hope that this presentation will answer a key question: what makes for effective collaboration in education in ethics, humanities, and the arts? And I will now hand things over to Dr. Gillis to begin our discussion.
Thank you very much, Dr. Debates. It is my pleasure to start the conversation today about collaboration with a group of colleagues with whom I've been productively collaborating with on scholarly projects in teaching and learning of ethics and the humanities and the health professions for about 18 months or so. First, I want to point out that all of us, all academics, engage in collaboration in the form of discussions and the exchange of ideas. But the kind of collaboration we're going to be discussing today is a more formal kind, where people teach and apply for grants together and develop research projects and disseminate the results of those scholarly projects together. Research collaboration, including co-authorship, research networking, joint research, and research partnership, is done often in the medical science disciplines. But for those academics from the humanities, solo research and authorship is the norm. While challenging, humanists working in health professions education may benefit from collaborative practice, and I will now outline some kinds of collaborations that you may consider. Common ways people in health fields collaborate is interprofessionally. Usually, interprofessional refers to different professions practicing together, and therefore interprofessional education refers to the training of practitioners in a field together. In health professions education, it is understandably a common practice because in their professional lives, medical school, nursing, OT, PT, RT graduates, for example, will be working together in the care of patients. There are also disciplinary collaborations. And here I'm going to refer to Marilyn Stember's 1991 article that outlines the different types of collaboration to help us understand these. Interdisciplinary collaboration refers to the working together within a single discipline. And an example of this would be like a group of bioethicists working together with a teaching intervention and researching that teaching intervention. A cross-disciplinary collaboration is when one views a certain discipline from the perspective of another. And an example I was thinking about here was when physicists have been contributing to an understanding of Vincent van Gogh's famous artwork, The Starry Night, not from an aesthetics perspective, but rather they note that the representation of the night sky that he depicts closely follows the mathematical structure of natural turbulence, such as that of swirling water. In multidisciplinary projects, experts from diverse backgrounds work together on a common theme within the limits of their own discipline. For example, and some of you may have done this before, consider a public program sponsored by a university where a film that fictionally depicts the life of a woman struggling with a diagnosis of early onset familial Alzheimer's is shown. And this is followed by a panel discussion of experts from medicine, film studies, gerontology, and anthropology. Now, it's hard for me to find a hard line between interdisciplinary and transdisciplinary collaborations, as they have in common an important factor, namely that of disciplinary boundary crossing towards the development of synthesis or unity for an innovative approach. Regardless, in either approach, the collaborators draw on their specific fields and backgrounds towards a common goal or aim. Thus, a transdisciplinary team is one in which members come together from the beginning to jointly communicate, exchange ideas, and work together to come up with solutions to problems. A multidisciplinary team, on the other hand, is one in which members use their individual expertise to come to develop their own answers to a given problem. It is easy to see the opportunities for collaborative scholarship of teaching and learning in the health professions if one is already engaged in interprofessional teaching. And for those humanists in the health professions looking for collaborations who are not already involved in IPE, they are a great first group to approach. Because ethics, humanities, and the arts are relevant to arguably any health profession and field, there are many opportunities to collaborate. within the college you were appointed in. For example, I'm in the College of Medicine, and I work with many departments to integrate ethics, humanities, and design thinking content, from cell biology to family medicine. Also, one may collaborate across health colleges and departments, across health colleges, and even across departments in the university. For example, at my prior university, I was involved in an initiative around women's health that involved medicine, social work, public health, psychology, gender, race, and identity studies, and philosophy. You may find others working in a similar area as you at another medical school or health professions college and attempt to study a similar teaching intervention in different student populations. And finally, while you may be teaching, for example, undergraduate learners in one health profession, you could consider applying your teaching interventions to learners at the same profession, but at a graduate level or even a professional level. Good collaborations and being a good collaborator are more than the sum of their parts. To establish a successful collaboration, you need to know what you can offer and how to position yourself in your discipline. And you must be able to call on and adapt your communication, management, and leadership skills. I now turn to my colleague, Professor Kendra Kirchmer, to share with us some elements of successful collaboration.
Thank you, Dr. Gillis, and good afternoon, everyone. I'm an architect and designer and faculty member of the Division of Ethics, Humanities, and the Arts and Design at Herbert Wertheim College of Medicine in Miami, Florida. As a designer, educator embedded within a transdisciplinary teaching team for undergraduate medical students, much of my experience is from a broad transdisciplinary approach to collaboration. And there are a few areas in which collaborations can run into challenges or friction points. One of them, interpersonal differences, also methodological and epistemological differences, and institutional and professional differences can all come up over the course of a project. At its core, collaboration is about teamwork, and we can probably all think of an instance in a team or group setting in which differing and possibly opposing personality types presented a barrier to achieving the group's goal. Collaborators who are stubborn or controlling or lazy, for example, can all create conflict within a group. And although some personalities are just simply difficult, clearly defining group roles and expectations can help mediate this to some degree. Ideally, in collaborations, such as those that we're discussing here, all the participants are well-intentioned and motivated and open to the contributions of all the group members. Approaching the project and each collaborator with an open mind, generosity, and respect for each other's views and expertise is foundational to a successful collaboration. Which leads to the next broad category of possible friction points. Different disciplines have different epistemologies and methodologies at the foundation of their research and process. In my experience, the more subtle the difference, the greater the chance that it will be overlooked at the beginning of the project, and therefore the greater the chance that these differences will be uncovered further down the line, creating larger problems. For example, in a collaboration between sculptors and marine biologists to develop a solution to revitalizing decimated oyster populations in the Narragansett Bay, the notion that there are different methodologies in place seems fairly obvious to all participants, and time was given early in the collaboration to identify and understand the different ways of working and definitions of success between the hard sciences and fine arts, eventually generating a collaborative methodology for the project. Conversely, during that same collaboration, the adjacent disciplines of design and fine art came together through participants from landscape architecture and the previously mentioned sculptors. There was a mistaken assumption that through their adjacency, the artists and designers had a shared understanding and worked in similar ways. Those assumptions led to continued friction and consistent territorial disputes throughout the process, resulting in misunderstandings and general frustration between group members. Generally speaking, in most collaborations, time is needed to build opportunities at the beginning of the project and discover the unique ways of working represented by distinct disciplines, and importantly, to avoid assumptions and approach the variety of processes with an open mind. And while differences can lead to misunderstandings and difficulties, it is also these differences and distinctions that provide the greatest opportunities for innovation. Institutional and professional hierarchies and values can add another layer of complexity and possible friction to interprofessional and multidisciplinary collaboration. For example, support for collaborative projects can vary wildly between disciplines and institutions, from differing institutional agendas and the value placed on the results of collaborative research to the availability of institutional resources such as access to a resource librarian or statistician's time, or even administrative support for involved faculty. Additionally, these agendas are not static and can shift over time, putting pressure on sustaining collaborations over the course of a long project. Further, hierarchies and formal titles create asymmetrical group dynamics. I find that it is generally a good idea to proceed somewhat informally with all participants on equal footing, creating a collective and collaborative community in which people feel comfortable sharing the broadest range of ideas. Working with others can be difficult at times. However, there are a few tips to keep in mind that can help smooth out this collaboration friction points. Adopting an attitude of humility is important to successful collaborations. As mentioned, disciplinary hierarchies, territories, and assumptions about process and products can all lead to discord within groups and ideas and stifle innovation. To build a creative communal space for collaboration, it is essential to leave these behind and to adopt a respectful, generous, and open approach to each of the collaborators and represented disciplines. Also, creating time and space for the collaboration is an essential component to overcoming challenges and also to sustaining the collaboration over a long term. Fruitful collaborative communities are formed over time, and groups need the space and time over the course of the project for this to develop and to accomplish the goals. Scheduling weekly or bi-weekly meetings or calls between group members can help maintain consistency and embed the collaboration within everyone's weekly routine. Finally, and potentially the most important tool for successful collaboration, is communication. It's a theme running throughout all the examples, and in most cases where challenges in a collaboration arise, a communication fault can also be found. Frequent and clear communication can help to clearly define project goals, structures, group roles, and expectations. But further, good communication is as much about listening as it is about speaking. And taking time to hear collaborators, actively listening to their ideas and views openly, is essential in establishing the trust and respect needed to form a successful collaborative community. And in wrapping up, a quick thought about play. No community can or should work all the time. Recognizing this and allowing for, even building in time for less formal, task-driven conversations provides additional support for the collaboration. Occasionally meeting for dinner or visiting a restaurant or museum as a group are great ways to help build community. Or even simply building in time for small talk before or after a meeting can help build connections. When successful, these sorts of transdisciplinary and multi-institutional collaborations are capable of achieving remarkable innovations, and I believe they are an essential part of the future of scholarship. And so with the idea of future collaborations and the future of collaborations in mind, I would like to turn the presentation over to Dr. Claire Clark.
Thank you for that. This section on the future of collaboration is speculative. So, we welcome your thoughts on the future of collaboration when we open the webinar up for discussion. One way it seems as though collaboration is going is that it will be less dependent on geographic proximity. And our collaboration, the four of us, is a great example of that. We meet twice annually at the American Society for Bioethics and Humanities and the Cambridge Consortium in Paris. And the Cambridge Consortium in Paris is where we initially got to know each other. But almost all of our work otherwise is done online. So we have weekly conference calls, and we put together most of our manuscripts and presentations in a collaborative format using resources such as Google Doc. That leads into the second point, that is how collaboration is likely to shape up in the future. And that is that the sort of old model, at least in the sciences of collaboration, where you have one principal investigator and then everyone working underneath them, is being phased out. So, for example, in my institution, many of the departments are changing their statements of evidence for tenure and promotion to reflect more team-based collaboration, when you have a team-based collaboration that's less hierarchical, often it's very difficult to tell who should be the first author and who should be the last author, because everyone is contributing equally to the development of the product. So I think that we will see the shape of collaborations look a lot more horizontal and flat, and we will start to see some of the ways that collaborations get rewarded or recognized shift in response to that. The third point is related to the first two, which is with the idea of collaborations being more democratic and more horizontal and less dependent on geographic proximity, opens the possibility of collaborations that are open and crowdsourced. And you see this, for example, and there are many grant initiatives right now that use something called community archivists. And the idea is that you can put archival material on the web, and then community members can help annotate that material, so that the scholarly work, the work of analysis that used to be kept inside the ivory tower, both in terms of resources and in terms of analysis, is really more open to the public. And then finally, there are, I do believe, going to be more and more incentives for these types of multidisciplinary, interdisciplinary, transdisciplinary collaboration, largely having to do with applied problems. So I think in some ways we could say that bioethics is an example of a inter or multidisciplinary application of different fields of scholarship to problems that arise in medicine. And I think that we're going to see more and more incentives for these types of collaborations, whether it's for producing research or developing new teaching programs. The humanities are increasingly being asked to sort of show their cash value. And so those of us who are trained as humanists are going to be thinking more and more about what we might have to offer real-world problems. And you heard many examples, whether those are in environment, engineering, or medicine. And with that, I think we would like to open up the floor to some discussion. So I will turn the mic over.
Thank you very much, all of you, for sharing your insights. Now I'd like to open our discussion between our collaborating presenters. Could you please describe one of the most effective collaborations in educational scholarship and what made it successful?
Well, when I think of my most successful collaboration, it would actually have to be my current collaboration with you, Dr. Gillis, to include design thinking methodologies within the medical school curriculum. We began very informally and defined the project together. And then we spent a pretty decent amount of time up front learning how we could work together, and we created a shared methodology for the project.
This is Maren Gillis. I think that Professor Kirchner brings up something important that I've found with throughout my collaboration with her, but also the collaboration with this Cambridge Consortium group. And it's that what I found in developing the relationship with the collaborator is that you find that you start with maybe one project, but as a result of working together and through these long, formal and informal discussions, you find that you have other projects that emerge as a result of this collaboration. So it seems to be like while it starts with the project, it can lead to in other directions that you might not have seen before.
Jump in here. I guess I'd like to add that with many educational projects, you have to build relationships beyond just the people who are working with you on gathering and analyzing and publishing the data. So, for example, I've got a project here that has to do with shadowing in different types of interprofessional clinical settings, and again, and comparing those in pre-medical and medical students. Well, I mean, my collaboration is not just doesn't just involve the other folks who are working on that research, but also all of those shadowing sites and all of those health professionals who, might not be authors, but certainly would be acknowledged in any of the papers that come out of that.
Thank you all very much. Could you also all share, for someone who's just getting started in collaborative scholarship in bioethics education, what would you recommend and where would you begin?
Well, hi, this is Maren Gillis again. And when Dr. Clark talked about her shadowing class, I couldn't help but remember that it was through a presentation or a discussion, I can't even remember, when I learned of Dr. Clark's shadowing class and that she had been teaching a pre-medical class in an honors college. And I was teaching a pre-medical class in an honors college on medical humanities and bioethics myself. And I was so impressed by the course itself, but also I found that we had very similar educational values and we had similar approaches and we were working on a similar topic. And so one of the reasons why I wanted to work with her was because of learning about her class and having that time to be able to talk about things while we were in a conference setting. So the things that I'll recommend then are that you'll, at academic conferences, to go up to the people that whose presentations that you hear that are interesting and have those conversations, between the sessions, and go up to somebody that you might not have met before and have a coffee and talk about things.
Second step to that is really what Professor Kirchner talked about, which is to then find time to let those relationships grow. And that's where meetings like Cambridge Consortium that are really more working meetings, sort of more working together on developing projects and have time and space for that can be great, versus presenting projects that you've already come up with. So either going to places that make space for that or finding the space and time for it is really essential.
Thank you all. We now are ready to take some questions from our audience here, and we have one that was just sent to us that I think is really interesting, and I'd love to hear our presenters navigate some of these things. So the question we have is how you balance different time expectations, particularly for medical professionals within their individual job descriptions. For example, a physician might have time to work on a research collaborative during certain weeks, but other members of the team have responsibilities in other spheres during the same time. So when your schedules don't really align very well, how do you make it work?
Professor Kirchner. I mean, so as an architect, I would say that, and I can't speak for the physicians, but your schedules can get kind of hectic, especially when you're balancing a teaching load and a professional career at the same time. But I think with all things, as Dr. Clare pointed out and I mentioned earlier, it's about making time. Although it's finite throughout the day, for collaborations that matter, it doesn't have to be a long meeting every couple weeks, but just spending even 15 minutes popping into the ongoing group meeting can keep your presence known and keep the ideas fresh and kind of keep you embedded within the process.
Hi, this is Maren Gillis. I agree with that because one of the things that I found is a very important element. Everybody's busy, regardless of what profession they come from. And I think that having regular meetings and timelines and what do you call it, a deliverable schedule, I don't know what the, so that you can meet certain goals, but make them little and have it recurring. Because if I don't, for myself, for example, if I'm not attending to something often, I forget it exists. And so if I were to have a long time between things, the next time I met with my collaborators, it would be like starting from the beginning. And I can't think of a more frustrating way to go on a project. And that would be something that I would just kind of dread doing as opposed to being excited about doing. So I think if you could just work it in and have short things, like the group that's speaking today, our meetings were never longer than an hour, and sometimes we were done in 15 minutes if we just had to do a recap, because it was important for us to meet regularly.
Things I would add to that would be to really make good use of shared documents, shared tools. So like having a collaborative format in which you discuss like who's doing what at this particular point, what stage it's at. So you don't even necessarily have to always meet in person. It can be more asynchronous, and that helps allow for different people's schedules to kind of lay out the calendar in advance and say, all right, here's when I'm on call. This is when I've got time for research stuff. Okay, well, you're on the next month, so I'm going to do like these 4 things, and then I'll pass it off to you, and then maybe the following month when I have more time, I can get back to it again. And so just being sort of knowing across the group or across the collaboration what it is that you're trying to get done in a specific period of time. And as Dr. Gillis pointed out, breaking it down into manageable bites makes a really big difference. So it's not going to be like, all right, we're going to get this entire research project done this month. It's more, all right, well, this person's going to work on the IRB application, and this person's going to do this piece, and this person's going to figure out which journals we're going to be looking to publish in. Like all those different sorts of things, so that the tasks get delegated in manageable bites. And that people can get together again with those sort of imposed deadlines from within the group that are manageable, but that force people to keep working on it on a regular basis. Makes a big difference. One other question that we have here. So in collaborative efforts where people have very different expertise and inputs, how do you handle questions like authorship, where the standards and expectations across fields vary widely?
This is Maren Gillis. This is an issue, and it's coming up more and more. Like I didn't mention before, I'm a philosopher by training and a bioethicist. And in philosophy, as in many humanities, single authorship is the norm. And it's not often that you have multi-authored manuscripts, and in the scholarship of teaching and learning, that does occur. And what I have found is that people coming from the natural sciences, the first author and the last author are significant in certain respects, and then it's just kind of a hodgepodge in the middle. And if your department chair, like you put your department chair's name on, you put the course director's name on if it's a teaching intervention. And this was difficult for me. I mean, I personally think the more the merrier, and I want to acknowledge everybody who's done work. But it was difficult because my intuition would have been that the first author is the one who managed the most on the project, and then it would go down in order of how much you contributed. So yeah, I think it is an issue. And so sometimes I've been listed as last author on something, and I've been told, oh, it's great to be a last author. And sometimes I've been listed last author on something because I did the least amount of work. So it's perplexing to me, but I know I've spoken to some of my colleagues on this call about it, and I would like to hear particularly from Dr. Debates on this.
That I've seen lately that's arising more, particularly for journals for which I serve in the editorial board in different capacities, is a specific notification and identification of how much people did on a particular article and what exactly they contributed to, and having that be part of the article itself is listing, okay, well, these people contributed equally and they were part of the sort of generation of the idea of the project, designing the research methods, actually conducting the study, and doing working on the results. And where somebody else may have primarily been coming in as a biostatistician and working on the results, but they're specifically labeled as sort of like, these people contributed equal work, these people contributed equal work, and here are the different things that they did. Because I think especially for these very interdisciplinary collaborations and transdisciplinary collaborations, it can be hard for readers or particularly for things like tenure and promotion committees to really know exactly what the contribution was so that they can give it credit accordingly.
In here and say that I think for collaborations, really the key thing is to work that out with your team at the outset so that you don't have you don't run into a lot of conflict or have somebody holding the paper hostage, right, because of an authorship dispute. So I've worked on a variety of different types of collaborative projects, and they have taken a variety of different approaches to authorship. When I was a fellow at the Centers for Disease Control and Prevention, I worked on a project, and everyone more or less contributed the same, and we did the authorship alphabetical. I'm working on a project here with a bunch of other teaching faculty in which we have worked collectively on the protocol and the instruments, and we're each going to facilitate a focus group with students from a different health profession school. So it's really going to be more or less equal in contribution, and because it's a group of us that are going to continue presenting and publishing, it has been proposed, although we haven't decided yet, that the first and senior authors be the people who need it soonest for tenure and promotion. There are other cases where you are working with people who recognize senior authorship, and that the person who's supplying the funding or is sort of the brains behind everything would be senior author. But sometimes you're working with groups of people who publish in places where that's not a norm. So I think what's really key with authorship is just that that's one of the very first discussions that your group has.
To have those discussions openly and forthrightly in the beginning, because just to minimize any disagreement or misunderstanding along the way too, especially where people are coming from very different disciplinary norms. It helps to say, hey, this is the norm in my discipline, this is the norm in your discipline. How do we work this out together in advance? Assuming that everybody continues to do all the things that they say they're going to do. One other question that I had that I'd like to ask, particularly, it grew out of what Professor Kirchner said earlier in talking about how designers and artists are working with marine biologists, and I find it really interesting. So I'm interested to know how you all sell interprofessional and particularly very unusual collaborative efforts within your institutions. How do you get support for those efforts, and where does that support come from?
Hi, this is Professor Kirchner again. The collaboration that you mentioned, Dr. Debates, between the marine biologists and the sculptors and the landscape architects was actually funded through a multi-university grant from the National Science Foundation, part of the EPSCoR series to promote experiment. Honestly, I can't get the acronym right at the moment, so it was essential to the collaborative grant proposal that the Rhode Island School of Design be included with the University of Rhode Island, and I believe Brown University was also on that, as well as Roger Williams. And so the grant proposal was written such that it was really a STEAM effort, so science, technology, engineering, arts, and mathematics all together in one. And so some of the outcomes of that had a lot to do with how to run a transdisciplinary collaborative effort, and finding out that it's often the closest disciplines that have the largest challenges to overcome, because it does seem quite obvious that sculptors and marine biologists or physicists or any of the hard sciences have unique ways of working, but it's often a mistake to assume that artists and designers or even landscape architects and architects can work without friction and don't need to spend some time understanding what the goals are of each profession and communicating.
To that fourth bullet on the future of collaboration, I wholeheartedly agree with Professor Kirchner, and I think that more and more it's going to be external funding that is going to incentivize and drive some of those collaborations. So another example of a funding opportunity is the Humanities Connections grants that are funded by the National Endowment for the Humanities, and those really require collaborations between, or encourage collaborations between one or more different schools or colleges. So the idea is that they're supposed to be incentivizing folks in arts and sciences to sort of reach across the aisle to more applied fields like medicine or engineering.
Thank you all for your really helpful answers to this. We have one other question coming from our audience right now. Do you have recommendations for folks who work outside of academic environments but are still interested in continuing research efforts, despite this not being a requirement of their job, and because of that, not something that actually receives support from within an institution?
That's a really interesting question, and I've worked with people on projects that have an impact in academics, but with people who don't hold academic appointments. And this is a kind of collaboration that, and especially if we're talking about scholarship of teaching and learning, which we haven't talked about, and I kind of call them educationally co-curricular projects, and these are projects where students are learning, but it's not necessarily it isn't part of the required curriculum. So, for example, we do a number of projects where we are engaging members of the community, and there are objectives, like learning objectives that they may have received in the course, but the actual activity that we're doing, or the program that we're doing, or even the research that we're doing isn't necessarily for a credit. And so in this way, we are engaging with people outside the community. So I think it would be, what I'm saying, I guess the first answer would be that you'd have to find a collaboration within the academy and to work together on something, but it's perfectly doable. And I've done these kinds of things with people who work in health profession settings, like I've done work with perinatal bereavement groups in hospitals. We have held vigil for people who are dying in hospitals and working with nursing staff there. And I've also worked with people doing art-making projects for people with Alzheimer's who are in memory care homes. And those people are not academics, but we've worked together, and we have disseminated the intervention that we work together on.
I think that some of this is going to depend on the particular context that people are working in, because there's teaching that happens in all sorts of environments, both inside and outside of academia. So for instance, people who are working in hospital systems may be doing continuing education or graduate medical education, or simply working with people to develop their skills, professional training environments. And so there's lots of different ways to be involved in education, even outside of sort of a academic environment, properly speaking. And so it can be difficult though in those kinds of environments when you don't get support for the research work that you want to do. And so part of it is sort of putting together your case for it within your environment and within your institution, saying this is why, not only why we're doing these interventions, but this is why we want to study them and figure out whether they're effective, why they matter, sharing those insights with other people. And that can help it may take some time, but help build support for those collaborations as well. If we have any additional questions, if you do have other questions, please send them through the chat function. I really appreciate all the questions that people have brought up today. If you do have other questions that you think of down the line, please do let us know, as we're happy to continue working with folks and answering those going forward. So thank you all for participating in today's webinar. I'd like to again invite you to attend the upcoming annual meeting of the Cambridge Consortium for Bioethics Education in Paris in July of 2019. Registration for the meeting is now available at www.icmbioethics.com. This also concludes our webinar series for the year on bioethics education research. Please stay tuned for the next webinar series coming up for the following year. This webinar is a production of Bioethics Education Resources, and I'd like to particularly thank Dr. Gillis, Dr. Clark, and Professor Kirchmer for their leadership in the Cambridge Consortium for Bioethics Education USA Working Group. We would also like to thank the supporters of the USA Working Group and BEdR. Our supporters include Oakland University, William Beaumont School of Medicine, Dr. Tommy Kushner, who is the co-editor of the Cambridge Quarterly of Healthcare Ethics, and Mr. Mark Zadrozny, who is the publisher and, from the Cambridge University Press. Thank you all to all of our participants, and we hope that you have a wonderful day.